What causes vitamin D deficiency? What's vitamin D? Vitamin D is an essential nutrient necessary to maintain healthy bones and teeth. It is available in certain foods, and if dietary intake or supplementation is inadequate, symptoms of vitamin D deficiency develop. The prevalence of vitamin D deficiency is reportedly increasing worldwide. About 1 billion people worldwide have vitamin D deficiency. You can get vitamin D in a variety of ways, including sun exposure on your skin. However, people with darker skin and older people may not get enough vitamin D through sunlight. Your geographical location may also prevent adequate vitamin D exposure through sunlight, through the food you eat, through nutritional supplements. Despite all these methods to get vitamin D deficiency is a common worldwide problem. Why? For getting vitamin D from our diet/through sunlight is only one way to obtain vitamin D. What causes vitamin D deficiency? In general, the main causes of vitamin D deficiency are not getting enough vitamin D in your diet and/or through sunlight. Your body isn't properly absorbing or using vitamin D. There are several specific causes of vitamin D deficiency, including certain medical conditions, weight loss surgeries, certain medications. Several different biological and environmental factors can also put you at a greater risk of developing vitamin D deficiency, such as older age and the amount of melanin, pigment, in your skin. Medical conditions that can cause vitamin D deficiency. Medical conditions that can cause vitamin D deficiency include cystic fibrosis, Crohn's disease, and celiac disease. These conditions can prevent your intestines from adequately absorbing enough vitamin D through supplements, especially if the condition is untreated. Obesity. A body mass index greater than 30 is associated with lower vitamin D levels. Fat cells keep vitamin D isolated so that it's not released. Obesity often requires taking larger doses of vitamin D supplements to reach and maintain normal levels. Kidney disease and liver disease. These conditions reduce the amount of certain enzymes, hepatic enzyme 25 hydroxylase from your liver and 1-alpha hydroxylase from your kidneys. Your body needs to change vitamin D to a form it can use. A lack of either of these enzymes leads to an inadequate level of active vitamin D in your body. Weight loss surgeries and vitamin D deficiency. Weight loss surgeries that reduce the size of your stomach and/or bypass part of your small intestines, such as gastric bypass surgery, make it difficult for your body to absorb sufficient quantities of certain nutrients, vitamins and minerals. If you've had weight loss surgery, it's important to see your healthcare provider regularly so they can monitor your vitamin D levels and other nutrient levels. You'll likely need to take vitamin D supplements and other supplements throughout your life. Medications that can cause vitamin D deficiency. Certain medications can lower vitamin D levels, including laxatives, steroids such as prednisone, cholesterol-lowering drugs such as cholestyramine and cholestyramine, seizure-preventing drugs such as phenobarbital and phenytoin, rifampin, a tuberculosis drug, orlistat, a weight loss drug. Always tell your healthcare provider about your medications and any supplements and/or herbs you take. How do you treat vitamin D deficiency? Vitamin D deficiency is usually treated with supplements. If a healthcare professional finds that you have a deficiency, they may recommend the following options. Supplements. Oral supplements are the go-to treatment for vitamin D deficiency. You can easily buy these over the counter, but should ask a doctor for dosage recommendations. Magnesium helps activate vitamin D, so you may want to take this mineral too. For a severe deficiency, a doctor may recommend prescription vitamin D, which comes in much stronger doses of up to 50,000 IU. Your doctor may also consider vitamin D injections. Food sources. Eating more vitamin D-rich foods may also boost your levels. Options include fatty fish, egg yolks, Fortified cereals. Fortified milk and juices. Yogurt. Beef liver. Because sunlight is a natural source of vitamin D, your doctor may also recommend going outdoors more often. However, given the negative effects of excess ultraviolet exposure, it's important to take precautions by limiting your total time in the sun and applying sunscreen. Summary. Vitamin D deficiency is usually treated with supplements, food sources, and mindful sunlight exposure. Thank you.